For what purposes, gentleman from New York, rise?
Mr. Speaker, pursuant to House Resolution 1674, I call up H.R. 847 and ask for its immediate consideration.
The clerk will report the title of the bill.
Union Calendar Number 321, H.R. 847, a bill to amend the Public Health Service Act to extend and improve protections and services to individuals directly impacted by the terrorist attack in New York City on September 11, 2001, and for other purposes.
Mr. Speaker, I'd like to recognize and yield 5 minutes to our colleague and friend and gentleman from New York, Mr. King.
The gentleman from New York is recognized for 5 minutes.
I thank the gentleman for yielding. Mr. Speaker, I rise in support of H.R. 47, in strong support of H.R. 47. And at the outset, let me commend my colleagues Carolyn Maloney and Jerry Nadler for the truly outstanding job they've done for all these years, and for their directness and their candor, and for always being there when the tough decisions had to be made. Let me also thank former Congressman Vito Fossella for the work that he did for a number of years when he was here in the Congress on this bill as well. And let me commend the leadership from both parties. I commend the Democratic leadership for bringing this back up for a majority vote. I commend them for it. I know it's been tough. There's been tough decisions had to be made, and they've made them. And I thank them for that. I also thank the leadership of the Republican Party for working with us and working with a number of us to make sure that there would be a fair and open vote here today and debate. So I thank them for that. And let me also say that all of us know this has been a long and tortuous route to get this bill to the House floor today. During that time, there's been frustrations, tempers have fled, but also, and probably most importantly, people have died, and that's what we have to keep in mind. This is a real human issue. We have people sitting here in the gallery today. Many of them have breathing problems. Many of them have pulverized glass in their lungs. Many of them have poisonous toxins in their bloodstream. So this is real. This is a real human issue. And I share some of the concerns that the Republicans have regarding, for instance, the funding stream, how this is going to be paid for. But the fact is, this is a good bill, and we cannot allow the perfect to be the enemy of the good. And it's more important to me, I believe, that we take care of those who are truly in need, and we look at the bill in full perspective and in full view, and take that and keep that in mind. Keep in mind the victims, the men and women who went to Ground Zero on September 11th and stayed there for the days, weeks, and months afterwards. And they were on that pile, and they now are suffering the most horrible diseases and illnesses which we see in our districts. When we meet these people, we see them in the stores, we see them at ball games, we see them in church. So this, again, is for real. And so let's today try to have the debate, as we are, I think, in a very civil way. Let's realize there are honest differences of opinion on both sides. But the reality is the people in the galleries, those who couldn't make it to the gallery today, they don't have the luxury of waiting another 1 year or 2 years or 3 years or 4 years. And I know that people on the Republican side have spoken about various programs that are available. But the fact is, this is such a unique type of disaster. The illnesses that have come from Ground Zero are very unique to Ground Zero, unfortunately. These are 9/11 type illnesses, the rarest types of cancer, the rarest types of blood disorders. It's essential that we have a permanent registry so we will know exactly how these illnesses will be treated, so that those in the other 430 districts around the country who could be suffering, for instance, from a cough, which a doctor may think is an innocent cough, will not realize it's a 9/11 cough. Those who have symptoms which may otherwise be undetected, they will not realize how significant they are and how they can be directly related to 9/11. And also, as far as whether or not this is an entitlement or whatever term we want to use, the fact is when it came to nuclear workers, federal nuclear workers, we set up the exact same type program. Call it an entitlement if you will, but that program was set up to take care and compensate those who suffered serious illnesses now, resulting from their work on nuclear plants or nuclear projects. As far as the issue of the Victims' Compensation Fund and all those who were compensated, the fact is the people we are talking about today, the victims we are talking about today, were people who didn't realize their illness until after the deadline had expired. People who today are just finding out about their illness. It's latent. It's in their bloodstreams. It's in their lungs. And back in 2003, when this program closed, virtually no one knew the extent of the illnesses and diseases that would stem from September 11th. But the fact is they are there, and they're getting worse and worse. And as you know, I see Congressman Weiner has just walked in, and he and I always haven't had the highest things to say about each other on the House floor. We are standing together on this bill today. And as he pointed out, I remember at the Energy and Commerce Committee hearing, the one thing we can be certain of is that the number of those who are entitled to take part in this program today, that number is going to diminish. It's going to diminish because they are dying one by one. So let's keep that in mind. This is again, it goes to the heart of what we should be as a Congress, what we should be as Republicans and Democrats, what we should be as Americans. And those of us, we all stood together on September 11th, and 9 years have gone by, and to many people it's something that happened a long time ago. But for those who are suffering today, it's something they live with every moment. So with that, I urge everyone to make this as much of a bipartisan vote as possible. Send a message to the country, send a message to the world, and send a message to the victims that they are not forgotten. And not only that, we're not giving them any charity. We're not giving them anything. We're just rewarding them what they're entitled to receive for them putting their lives on the line for us. So with that, I urge adoption of 847, and I yield back the balance of my time.
The gentleman from New Jersey.
Thank you. At this time, I'd like to yield to the Speaker of the House 1 minute and point out that if it wasn't for her efforts, we would not be here today moving this legislation.
I thank the gentleman, but I in turn want to salute Congressman Peter King, Congressman Carolyn Maloney, Congressman Jerry Nadler, and the entire bipartisan New York delegation for giving us this opportunity today to do what is right and fair and just. Mr. Speaker, in observance of 9/11 earlier this month, we stood on the steps of the Capitol, Democrats and Republicans alike, to honor the memory that we lost that day. As we were standing there, I was thinking back to my first visit to Ground Zero. When you went there at that time following the tragedy, you knew that when you stepped there, you were walking on sacred ground. There was an incredible silence as the workers feverishly tried to retrieve the remains of those who were lost and just repair the damage that was done, to clear the wreckage. No pictures were allowed in recognition that we were on sacred ground. No photographs were allowed, and of course, silence was generally observed so that those who were working could hear each other as they quietly went about their very, very sad assignments. They and those who rushed to the scene in real time when it happened risked their lives and their health to do so. They didn't ask any questions. Is anybody going to take care of me? They were there to help. Again, back to the steps of the Capitol. When we were standing there earlier this month, I'm sure Mr. King and Congresswoman Maloney, Congressman Nadler, Congressman King, and others recall that many signs went up in the crowd that was gathered there. It said, "Remember us next week." That was in anticipation that the bill might come up the following week. Well, it's another week later. And we're here today to say that we do remember you this week. We remember what you did at the time. And it wasn't only your sacrifice, it's the sacrifice of your families, of your health and the impact that that has on your families. You are community to New York, so the impact that it has on the community, and also the impact on our conscience to do what is right by those who we call heroes and we want to treat as such. Today, we'll remember all the heroes of 9/11. We praise the strength of thousands of firefighters, rescue workers, first responders, and medical personnel who turned tragedy into inspiration and gave of themselves to help a city and our nation rebuild. We promised to help those who spent days, weeks, and months doing the hard work our government and the American people expected them to do in the recovery effort. They went above and beyond the call of duty. We all know that. We all looked in frustration to think if only we could help. But they were there. It was emotional, but it was professional. And we pledged to do everything in our power to ensure that their health and well-being would be taken care of. We did not want them to be unsung heroes. We want them to be recognized heroes. Today, we are here to honor that pledge. It's long overdue. But nonetheless, we are here to do right by these workers and vote for the James Zadroga 9/11 Health and Compensation Act. Words are, of course, inadequate to recognize and honor the bravery and courage of these brave Americans, but by this act of Congress, more than words, but by this act of Congress, we can truly express our gratitude to the ordinary men and women, extraordinary men and women who took extraordinary action at that time. Named for Officer James Zadroga, a hero of the New York Police Department, who died from respiratory disease contracted during the Ground Zero recovery effort, this legislation will help those who jeopardize their health to rescue others secure necessary medical treatment, especially for the unique exposures suffered at Ground Zero, which are real. Ensure survivors and victims' families can obtain compensation for their losses through a reopened 9/11 Victims' Compensation Fund. It is fully paid for. This legislation does not increase the deficit. It is the least we can do for those who answer the call of duty and continue to suffer the ill health effects of their service. On September 9/11, all Americans were shocked by the horrifying images of terror and destruction. Yet, in the aftermath of that dark day, we responded in the best possible way, the best way Americans can, with resolve, with courage, with unity, and with hope for a better future. So many of us couldn't be at the scene ourselves. We all were willing to help. People from all over were trying to send assistance. Those who did, though, did not do so for recognition or accolades or awards or medals. They did it because their fellow Americans were in need. In those acts, they became heroes. The American people are looking to us to cast a vote that will allow these heroes to live out their lives with health and happiness. Again, I want to commend Congresswoman Carolyn Maloney, Congressman Jerry Nadler, Congressman Peter King, thank you, Peter, for their efforts to bring this bipartisan bill to the floor. We are all inspired by the firefighters and first responders who have advocated so hard and so long on behalf of their fellow heroes, and I'm so pleased that so many of them are with us today to help us make this historic decision. We must now join together to provide this critical assistance. We must vote aye for the Health and Compensation Act. We must do so in a strong bipartisan manner. I thank our colleagues for the personal involvement that they have taken in this. At times it has been emotional. There's a lot of passion in this issue. But this bill is a very dispassionate response to the needs of our heroes. Let's get a great big vote for it today. I yield back the balance of my time, Mr. Speaker.
The question is on the passage of the bill. Those in favor, please say aye. Those opposed, say no. The ayes have it. The bill is passed without objection.
Mr. Speaker.
Gentleman from California.
I call for the yeas and nays. Recorded vote.
A recorded vote is requested. Those favoring a recorded vote will rise. Sufficient number having risen, a recorded vote is ordered. Members will record this vote by electronic device. This is a 5-minute vote, members. Vote.
On this vote, the yeas are 268, the nays are 160. The bill is passed. Without objection, a motion to reconsider is laid upon the table.